record that. All right. So as I was saying, you're going to want to have your date of engagement, your enrollment start date, and then that doesn't necessarily mean that their enrolled in path question is going to be yes at this point. It could still be no. And then state of status determination would be whatever date, again, sometime on or after the enrollment start date, or the initial outreach and engagement date. And once you've established those dates and yes or no for enrolled, you can come back at a later date and change the enrolled in path to yes should that enrollment status change. So it's not a written in stone. It's a flexible field, and you can update if you need to. Okay. So again, date of engagement is usually the hope is that you're going to get as close to the date you add them to HMIS as in being in HMIS, but not necessarily enrolled in path. And I'll get into that nuance when we look at HMIS, but I want you to kind of separate the two, that just because you're creating an enrollment in your path project for a path client does not mean that they're quote unquote enrolled in path. That's why in that one-time field, they have that status where you can say yes or no to enrolled in path, because they do understand that they're asking you to engage the client who may not be willing to give you all of the information in order to determine if they're path eligible. And that might not happen for some time after first contact. Okay, and then as we said, date of path status determination is going to be on or after that program enrollment date and on or after that first outreach date. You're determining the enrollment status for each path client in order to count the number, obviously, of enrolled clients. Path enrollments occur at the point when a client has formally consented to participate. So that's where you talk about the enrolled in path yes, no, if they're willing to engage in path level services, whether it's interventions for housing, substance abuse, mental health, whatever it might be, whatever case management service. And of course, and if they meet the eligibility criteria, then you can have your person, the status be enrolled in path. Okay, so we'll talk about contacts. Contact is the interaction between the path funded worker and the individual who's potentially path eligible or is actually already enrolled in path. Contacts may range from a brief conversation the client's willing to work with the case manager, and then obviously to accept any referrals for service. The contact may occur in a street outreach setting or in a service setting. You know, could be at the emergency shelter or a drop-in center if you have access to drop-in centers. Engagement is the point at which the interactive client relationship results in a deliberate client assessment or beginning of a case plan. Engagement is a one-time event, may occur on or after the project entry date, and must occur prior to path enrollment. So again, there's that nuance of path enrollment. Path enrollment being different than being added to HMIS. Client cannot be enrolled in path without being engaged, so the engagement would have come first, which is usually what that enrollment start date in HMIS is going to be, is probably going to be around or similar to that first engagement date should the client consent to that. Some interactions with the client may result in positive outcomes, such as getting them into shelter, but no, you can obviously read on. So essentially what it comes down to is that what the steps are trying to outline is that sort of date of engagement, that moment when you start working with the client, the date when you're able to establish some type of status on the client for, you know, yes or no enrolled in path. And then the contacts are essentially those contacts and services that you're engaging with the client when you're providing them some type of service or offering them some type of service. Okay, and then again, engagement is explained a little bit more detail here. Enrollment, a path eligible individual and a path provider. So when you're getting into the term enrollment, there's an agreement that the person is willing to engage in services of some type, and primarily for the purpose of meeting, they meet the eligibility criteria and they're willing to work with the outreach worker on a more clinical and more deliberate basis. It's not just sort of the passive contact. It gives you the HMIS data element 4.2 path status. That's in the the Data Standards Manual for HMIS, if anybody ever wants to look it up. It gives you some additional information as far as rationale goes for what enrollment means for PATH. Path exit, this is sometimes a moving target. Each community can generally establish their own criteria for this. In Connecticut, we generally follow the 90-day rule. If the case manager hasn't been able to either locate or engage the client 90 days after the last service, then the client will be exited from HMIS. So if you know that the last service for a client was on May 1st and nobody's seen or heard from the client, since May 1st was the last time any kind of service was entered into HMIS, then at that point you could go ahead and exit the client. It would not be considered a re-engagement should that client surface again. You've already exited them, so you would have to start a new enrollment whatever time period you set. Once they've hit that time period and you exit them, if they resurface a day later, you would start a new enrollment. Okay. But let's say if your last service date was 5/1 and then 7/1, you still haven't exited the client, but they've reemerged, then you could start the re-engagement process. Okay, but you can't call it re-engagement if it's after exit. And there are re-engagement services that you can identify in HMIS. And there's obviously the definition of re-engagement, which you can all read. As I said earlier, it must occur after enrollment and prior to an exit. All right. And they don't give you a real time frame for what disconnected from PATH services means. And again, this is kind of going back to that sort of vagueness when it comes to PATH. It would be nice if they said, a re-engagement equals 30 days of no service or 75 days or some metric. And again, even with exit, they're somewhat flexible, saying you could say 30 days after last service, or you can say 90 days after last service. So again, the boundaries are a moving target with the PATH activity. Referral is pretty straightforward. The active and direct PATH staff support on behalf of or in conjunction with a PATH enrolled individual to connect to the appropriate agency or organization to meet whatever need that person may have. And you do have referral options in casework. Right. Services, and it's a specific event. There's items in Caseworthy or in HMIS that you can use to identify a PATH service. And we'll go through the list of services that are available there. But the PATH services and contacts are what will hopefully end up on the PATH report as long as the PATH client has been enrolled properly. And there's just, oh, did I give that twice? I might have. Get rid of that. We don't need that. Okay. So those are the general terms for PATH. And they're part of the PowerPoint, and the PowerPoint will go out post once all the trainings are done. We'll get things organized and sent out. Does anybody have any questions about some of these definitions?
No.
Okay. So we'll go look at PATH and look at some of the areas of PATH that you have to focus on. Aside from enrolling the client, so we'll use this sample client, and Truman Medical will be the guinea pigs, their project for this particular exercise. When you enroll the client, you have the one-time field, which is where you find the date of engagement criteria, date of PATH status determination, did the client become enrolled, and then reason not enrolled if you say no. So you're going to be on or after enrollment, and here you're going to be on or after engagement. So date of engagement could be, and usually will be equal to the project start date, just because usually you're trying to, if the client agrees, that's when you're trying to capture that first contact as, when you start working with them and you want to start documenting that you're working with them. The date of PATH status determination is when you've decided yes or no for PATH enrollment and then became enrolled in PATH. I'm actually going to change this to yes for right now. Wait a minute. Clear that, and then I'm going to change that to yes. These are flexible. You can change them as you need to, and then they'll update. So again, it's not something that you can't edit as you work with the client. Assessments, for those of you who have done enrollments, the assessments are pretty standard. They're the standard assessments that you answer. If anybody wants to, we can go through a path enrollment to see some of the assessments, but essentially it's the HUD Universal Ed program, financial, health, veteran. You do have the option to add services during the assessment or during the enrollment process. You don't have to add them there. You can always add them after the fact. And you also do get the path, the one-time fields, as they're called here. They do come up during the enrollment, but I did notice, and some of you may have noticed this as well, if you enter them during the enrollment workflow, they aren't populating after the workflow. So we're gonna have to take a look at that, because if you're gonna put them in during the workflow, then I would assume they would stick. But if you have noticed that, then that's fine. And again, it's something that I am aware of, and I'm not sure why it didn't hold after enrollment. I want to go. Yep.
So there's a weird thing where I've like accidentally put the wrong date for engagement, and then tried to do a past enrollment. And if I put the wrong date in, and then I try to put the date of engagement in later, it says it has to be on or after the date of whatever. So
yeah.
When I edit that, and I go back and I say, oh yeah, I put the wrong date in, so I edit that, it still won't let me do it.
Okay, let's make sure we're talking about the same dates. So what date were you trying to change? The date in here?
Yeah.
Okay, so this client has a project start date of 8/1 and a date of engagement of 8/1. So what were your dates in your example?
I can't remember.
Okay.
I think it's like if I were just to pull up and do an assessment or a path enrollment, and then when I was doing the enrollment for last week, but I forgot to change the date to last week, and it just populated whatever today's date is.
Right.
Then if I'm going in and hitting those one-time fields that says date of engagement, and I say, oh, that was last week. Oh, I forgot to do the correct date. I found that it won't let me go back and edit my enrollment. That won't. I can edit it, but it won't recognize it on that date of engagement.
Okay, so let's talk about that a little bit. So you're editing this date here?
Yeah.
Okay, you have to do that in two places. You have, if you edit this date, that is maybe I should back up, and I'm going to talk a little bit about Hmis Landscape. So this is the household start date or enrollment date. Anything on the project enrollment screen is related to the head of household, regardless if it's a single person or a person who's head of household for a family of 5. So what you're seeing is the household start date. Now you can edit that. You can edit it up here.
Right.
Yeah. You can also, well, it's really the only place you can edit that one. But if you're going to change this, you have to change it not only here, you also have to change it in the member enrollment. And the member enrollment is tied to the individual. So you would also have to go here. And then click here. Oops, sorry, up here rather. Add edit. And then in this case, it's this client, and you would have to change it here as well.
Wow.
So the top level information you have, as I said, is the household level. Then the member level is what is tied to the actual client. So you would have to, in order for this to recognize a change, it would have to be both spots. Now, let's test my theory, okay? So let's say that, let's give it a date. So let's say that you wanted this date to be 07/01/2018. Now, and that was, you wanted a date of engagement change, correct?
Yeah.
Okay, it won't let me do that because obviously that's before a project start. So I say, okay, I'm going to cancel that. I'm going to change this. 701 to 18. All that. Okay, now I've changed it at this level. As soon as it populates, you'll see I've changed it here. Now if I go try to change the date, I'm hoping I'm going to get an error message. Okay, so it still sees it as not being within the project start date. So it should, after I edit here, allow me to update. And also keep in mind, if you're changing program enrollment start dates, you're going to want to update assessment start dates as well.
Right.
All right, so now let's see. Who wants to do the drum roll?
I'm doing it in reply.
Are you? All right, here we go. And it allowed it to happen. So there we go. So that was it. It's just, yeah, so you have to change your member start date as well. Okay.
Man, I've just been deleting these.
Oh my God.
Yeah. So, so as anything, as all rules apply with HMIS, you know, try something a couple of times, and then just send in an email and get some help with it, because it's usually something silly, and it might be something you might not have been exposed to yet. So, yeah, you don't knock yourself out trying to fix something little like that.
Exactly.
All right, so we've got our the enrollment, and again, like I said, we've got our date of engagement and status determination, all that stuff. But again, we'll go into the we'll talk about caseworthy a little bit more since that enrollment situation came up. There's another dynamic you have to watch out for, and that is, and I know this is something that you all at Truman have run into as well, is the family setup, where sometimes you'll see a client and you'll see these clients underneath that client, and you're like, wait a minute, that person doesn't have a family. Why are they in our enrollment? Well, they're not in your enrollment. They're just saying that this client at some point was associated with these other people. Whether or not that's true is a different story, but that's what the system thinks. The only way these clients are causing you a problem is if they also have an enrollment in your PATH project, for example. If they don't have an enrollment, and we'll look at like this child, for example, you can see this child doesn't have a PATH enrollment, so this child is not impacting your PATH data. So it's not necessarily wrong that they're here. You just want to make sure that they haven't been enrolled in the program with the head of household if they should not have been. The other dynamic is in the family and contacts, is where you'll see if a person is associated with more than one family, which I know has come up as well, where you look up a client and two records come up, one with one family name and one with some other weird family name, and you're not sure which one is your client, which family your client's associated with, so you kind of have to pick one and look, and if it's not them, then you have to go back to the other one and look. But essentially, a client can be a part of more than one family. HUD allows for it, and the system obviously allows for it. What's important to know is which of the family IDs is associated with your client's enrollment in your program. You see the family name in the project enrollment screen, and I'm going to show you in a second, but actually, let's do this. So this is the family name here, and the family ID. If we go back to the project enrollment screen, you'll see that this client here, this enrollment, is associated with this family. And if you look, you can say, okay, that's the right family. That's the one I want them to be in. And you know that that one is linked to your enrollment ID, which is for your particular project. Which brings me to the next topic, which is enrollment ID. You have the client ID, which is specific to the client, and you should only have one client ID for each client. I know there are duplicates. And then for every enrollment that you create for a client, a unique enrollment ID is created. So this is always a great way to communicate with either Nutmeg or with Mark when you have an issue, tell us the client ID, tell us the enrollment ID, and then tell us the problem, because then we'll see exactly what enrollment you're talking about, and it'll be a little bit easier to resolve. But just be careful. Don't ever, number one, don't ever delete an enrollment, even though you have the power to do so. You have the power to delete here. Just don't do it, resist it, have us help you with it, and don't ever, in any circumstance, come in here and put an end date on a family, which you also have the ability to do here. You can edit the family, and you can then, by hitting these check boxes, you can put an end date here, and that will make the family disappear, but it'll also make any enrollments associated with that family disappear. And it may be that that family was a legitimate family that was being worked on by some other agency. You have to also keep in mind that you're now part of an open system, so you will have shared information. That's why you can see more than just your project enrollments here. So just resist the urge to delete or end families, and resist the urge to delete the program enrollment. Let us know if there's something that comes up that you feel should be removed. If you ever happen to delete an enrollment by accident, you can go up to you can go up to this teardrop in the top right and click on the recycle bin, and any deleted enrollments will be here. There'll be a little checkbox that you just check, and then you hit restore, and it'll bring the enrollment back. And that was just a few items with Caseworthy that you should all be aware of if you're not already. All right.
How long do things stay in that recycle?
Forever, pretty much, unless we do a hard delete from the back end. If we go in and clean that out, then it would disappear. All right. As far as services go, every path client needs a service. You have a couple of choices. You have contacts and services. Contacts are a little different than a service. So you have a path contact here showing, where you met with the client, the date you met them. So add new. And so if there is some type of service engagement, you should try to have that contact associated with it. And we'll do path and service type. We'll just say was in this case, we'll put it as a residential setting. And is the person on the streets, whatever it might be, and you can say yes. And that'll establish the contact, the date of the contact, where the person was staying. You can have, and then you can, if you do have a particular service for a client, let me actually go back here. Go to services. And you can create your service here. Obviously, assign your project. And then your service screen will populate, and you can create your service, whatever it might be, whether it's a service or a referral. But every time you interact with a client, you're going to want to make it at least, at the very least, a case management contact. If it was a specific event, then you can identify which event it was, whether it was maybe for medical insurance, or maybe it was to talk about housing, community mental health, whatever it might be, and just whatever time frame for that service, and then save, and you've created the contact. So all somewhat very simple, as far as things go. The challenge comes when it's time to look at the report, which we'll get to. But before we do anything with the report, does anybody have any questions about enrollments, contact services, or any of the one-time field data?
Are we going to be able to have access to these slides once we leave here?
Yes.
Okay, good. I have a question. So on the report, when it shows when I run it for a date range,
Yeah.
which date is it pulling from? Like my project start date or the enrollment date?
Oh, so say that again, when you run a report?
Yeah, if I wanted to know who was enrolled between July and August.
Got it. Yeah. Yeah. So that's always a tricky one with this report. All right. Because you have a couple different scenarios with a path client. You can have a client who is active client, became enrolled in path is no, and date of status determination is during report period, okay? You have new clients whose determination is between, the report period. So a lot of it stems from those one-time field dates. And so you have the new clients or enroll clients, program enrollment start date. So for this one here, so instance of contact from first contact until date of enrollment for all active clients who became enrolled in the reporting period. It's program enrollment start is during the report period. Contact and service must occur on or after the enrollment start date and on or before the date of path status. So again, a lot of nuances to what puts somebody in a particular box. All right. Number of persons contacted this reporting period who could not be enrolled. So now you're looking at new or active and date of path status is dated during the report period, and client became enrolled equals no. And then so on and so forth. So these we can make available that have the definitions. Now, all that said, I'm still dissecting these, trying to get data to populate and then unpopulate. So I'm confident that it's working properly, and I'm not yet. So hopefully we'll have that narrowed down soon. But if you've put a client, you've enrolled the client into HMIS, you've filled out the one-time fields, you expect them to land on a particular box and they don't, just send an email and say, hey, client 12345, I expect that person to show on line 11 of the path report, but they're not. And then we can take a look and see why that might not be happening. The majority of the clients are going to show as active and enrolled, and date of status determination is during the report period because the client became enrolled in path equals yes. And that's again where the majority of the data will lie. That's where it'll end up. And then of course you have those who received the mental health services through any funding source at any point during the report period, and then total number of people in a path eligible program. So here you have line 16 need to have the mental health service with the referral as attained I'm sorry, that was for line 16 rather. And this is just the total of persons served. So that would be your 225 and 84, or 81 rather. And that's 306. Well, oh man, there must be a duplicate there somewhere. So this is an unduplication, or this is an unduplicated count of clients. So these two will not add up because there's probably clients who land in both places. So it would be, should be a deduplication of the count there. All right, and then services, a little bit easier to dissect. You do have a sub-report here. When you run the report, you can click on this, it'll give you the detail, and you can make sure that, if you expect more people had a community mental health service, you can see who the report is seeing. And then you can go in and figure out, okay, well, why is this number not 100? And, I expect it to be 197. And then you can determine, take a look and see what might be going on. If you can't figure it out relatively quick, just submit an email and we can help you figure that out. The remainder of the path report is fairly straightforward. It looks for referrals. And then all the other data is basically demographic data. The one problem you will have is income. You won't be really able to assess this. You're actually going to have to run the APR to really assess this data if you really want to know your income stuff for a path for path clients. Otherwise, the rest will show on the majority will show on the outcomes sub-report. Okay. But if you haven't run your path report, you should give it a try and try to determine, if you believe or feel that the numbers are correct. As I was saying before, this stuff is exportable, so we could actually look at, if you ran the report here, you could actually get a detail export for this number. You could click on it and get the detail there. You can click this number and get the detail here. If you want to assess the whole table, I would use this value and see all the clients who are being pulled on here and determine if there's anybody missing that should be showing up here who are clients who are not enrolled in PATH. So if you know you have people who weren't enrolled, but you're not seeing data here, there's either a date mismatch, meaning the date of engagement, or sorry, the date of determination is outside the report window, or if it's within the report window and the enrolled in PATH equals no, then I would send it in. I would send in an email saying, hey, I'm expecting this person to land on this line or that line. All right. It's going to be a work in progress, especially for PATH because of the complexities of the report and the different moving parts for the report. Especially, you guys are, you're still in somewhat of a cleanup phase. So the PATH report is going to require that, we all communicate about it, make sure that we've dissected it, and then we can go to caseworthy and let them know if we feel something isn't working properly. Okay. So is there anything specific as far as we could do, again, like I said, we could do an enrollment. We can do, I mean, you've seen the services. We could do an exit, or we could try to dissect the PATH report at this point if people want to dig into that. If there's a client you would expect to see on your PATH report, the only thing I would do is I would just have to stop the recording because we wouldn't want to record actual client data. But you all, certainly all being HMIS users, it's fine for you to see the data that we talk about. So the next step is, go ahead.
I have a question about line 16.
Okay.
So the note said that they have to have an obtained referral for community mental health account. Is that right?
Line 16 to have the mental health service with a meaningful with the referral as attained. Yeah. And this is also active enrolled and has a community mental health PATH funded service or community mental health PATH referral where the outcome is attained.
So they've received the service or an attained referral, but it doesn't have to be the referral?
No, it could be that they've got a mental health funded service or the community mental health PATH referral where the outcome is attained.
Okay, cool.
Yeah.
I have a question.
Yep.
I'm Carrie from Slope,
Hi.
and on these fields, like for example, number of new persons contacted this reporting period and a PATH services only project, how do we get that number in there? Does it come from the
Go ahead.
Does it come from like the individual case manager who's our PATH case manager? So every client she sees is automatically going to populate in there?
Okay.
Or do we have to enter the person and say they were ineligible for PATH or they were outreach but not enrolled?
Yeah. So
where do we say that at?
Yeah. So the rule for this field is here. The client is an active client, or is in, and meaning that they're active in the system. They have the enrollment, and enrollment is a bad term when it comes to PATH, but they're in the HMIS project for PATH. They're enrolled in PATH is no, and date of status determination is during the report period, so it falls between, in this case, 7/1 to 6/30.
So we still enroll them? I mean, we still enter them in the PATH?
Yes.
Yeah. Are they enrolled to PATH, yes or no? And on every client? I haven't seen that. for engagement, yeah, you're engaging with them, and you bring them in and assess them, you find out that they don't qualify for your service, you refer them out, from that point you would say, no, they don't qualify for PAL. Is that right?
Yep.
I think we do it different than you guys. They can see other case managers at our center, other homeless case managers.
But is it PAP?
No.
So then they're not
I only
eligible for
have
PAP?
one person that does PAP. So I'm asking, does she enroll in the PAP and say they're not eligible?
Correct.
So she still has to call them,
Even if they're not eligible?
and just say not eligible.
Mm-hmm.
And get them to count.
That's where I understand it.
Yes. Yep, you would
But
put them
she
in.
still goes- So
Mhm.
even though, like, say we do an outreach,
Mhm.
we go out in the community, we meet some people, they're not eligible for PAP, we have to enroll them anyway and then say not eligible?
Yeah, you would, if you're funded to do outreach to the homeless, and you would, but again, you would make sure they understand that, through conversation, that, during that outreach conversation, if they're a homeless person, you're going to offer up saying, hey, if you find them to be homeless in that conversation, that's when you would talk to them about HMIS and adding them to the system. But you wouldn't just add them to HMIS. If you just bumped into somebody on the street and talked to them, turns out they're not homeless, you probably wouldn't waste your time with that, because they're not going to sign the release to go into HMIS. You could create an anonymous entry, but there's really no value to that. So this would be something that you would engage with the client, and if you only see the client once and never see them again, and they haven't signed the release, then you would do nothing. But if you've engaged the client, you've talked to them, they're a homeless individual, you've talked to them about HMIS and what it can do as far as helping them, expedite housing, because now, they can be part of the system where housing can be obtained. And if they sign that release, then you can add them to HMIS.
Okay, well, all of our people sign a release,
Okay.
but if the client knows I'm not eligible because I have no mental health diagnosis, never have,
Yep.
and I'm not going to qualify, why would they answer the PAP questions when they know they're not eligible?
Yeah, again, that's for Path Outreach, they want to know how many people you're engaging.
Right,
That's-
but I don't think we have to do an intake on every single one.
That's,
Outreach people, your people in the community that are outreaching, they're the ones that are going to ask the questions. And right. Yeah, I can't. We set where they come in, we talk to them, do the assessment.
Because your first
If they know
engagement,
they're not eligible, why are they going to?
well, they don't know that they're not eligible. Not until after. Your first engagement is different than your assessment date.
Right.
So when they're engaging with them,
Is that right? But I think
Yeah.
to engage, you have to enter a bunch of data too.
but you have the data not collected or client refused options also.
Okay, good to know.
Yeah, the Path enrollment, why don't we do one? The Path enrollment, you have a lot more flexibility than you do with other enrollments. Hold on one second. Let me just, oh, you guys don't have exit, no assessment, do you? No, you don't. Okay, let me just do this. But with Path enrollment, you have a little bit more flexibility on responses, because you're outreaching to clients, you're outreaching to people. They're probably not going to have a lot of information or want to give up a lot of information. So data not collected or client refused is going to be fine, especially for a client that is not eligible.
Okay.
That's it. I'm just going to clear out my enrollment data for this guy so I can re-enter him. Path. All right. So let's walk through the scenario that you have for a path client. So for HMIS, you're just going to go to HMIS intake and put in your client name. Hit check for duplicates as always. If you see them here, then you add them. If you didn't, you would say this is a new client. Provide as much info as you can. For path, obviously, social security number, you might not get as frequently as you would for other project types. A lot of people aren't going to be willing. Now, if you're engaging them on the street and you're at a particular address, you could use that as the address. If you're engaging them at a drop-in center, you could use the drop-in center or an emergency shelter, or at your own office, you could use your own office. But the system is requiring that you provide some type of address. Right. This is the, when you're doing an enrollment, if you see more than your client here, this is just telling you that there's other family members. You don't have to do anything with them. You don't have to remove them. You have to edit them. You have to change anything. It's just saying, hey, this person historically has been associated with these other people. You can just save past it. But if somebody needs to be added, like if there was a family member you know should be there, you would add row and add the information. But otherwise, you can just save past this. Then the program enrollment screen, you should have your family name will show up there. Your enrollment start date will back off to here. And your open date stays open, never enter an exit date. There's a default date that will come in here. 12/31/9999 is a code to the system that this is an open enrollment. Click project and then make sure you identify your project. Pre-enrollment would not be our project, it would be this one. And provider will auto-populate. You don't have to worry about a count. You can assign a case manager if you want to. That should give you a list of case managers available. And then you can hit save. You've now started the enrollment for this client. The other household members that are associated with the client are going to pop up here. You ignore them if they're not part of this enrollment. You only hit the checkbox for the client that you want to be enrolled. You do not do anything with these other two. And just make sure that the end date stays open, your start date, enrollment relationship to head of household is self, and then you hit save. I'm not going to copy assessments on this one. So here's your, this is the one thing that I'm not sure why it's doing this, because this should populate after I create it here, but the system doesn't seem to be doing anything with this data, which makes me wonder if that might be part of the report problem. If this data is being left in the background, it might be interfering with the path report. All right, so date of status determination. We'll go back to here. You have date of engagement, date of path status determination. It can be before or after the program enrollment date, and on or after the outreach engagement date. To determine the enrollment status for each client, in order to count the number of enrolled clients, a path enrollment occurs at the point when a client is formally consented. So you're going to identify the date, but then you're going to say yes or no here to being enrolled. And actually, I want to test something. 08012018. So let's say the date of your project entry date into HMIS is 8/15. Your date of status determination is going to be 8/1, let's say, because let's say the first meeting happened at 8/1. And then client became enrolled in path, we'll say no. And then reason found ineligible, and then save. Okay, it's still going to ask you the rest of the questions, but it also knows that this client on August 1st was identified as not being eligible.
Okay.
All right. It does seem like busy work, but you know, it is helpful because now the client's in the system, and should somebody else run into this client, they might find that the information is a little different the next time around, and you have saved some time for somebody because you've provided some baseline data. And now that the client is part of the system, it will enhance their chances of finding housing if they're truly homeless.
Everybody that we see feel make sure that we can keep the contact, still contact.
And this is where you get some of the just generic screens in your enrollments. You can save past here. Reservation is generally associated with a bed, meaning the person's been put in a bed. So you're always just going to say done here at the bottom. And this would be the veteran assessment. If the person is a veteran, you would add the veteran info. In this case, there's already veteran info. I'm not going to worry about that though, because I know that because I entered the veteran info. So I'm going to say done here. This is the service spreadsheet. So this is your first opportunity for a service for this path client. You can create it here. It's fine. Just hit search as long as the project enrollment is titled correctly. And then you can call it a case management service. It should be down here somewhere. There you go. Bring it down a little lower. Hey, where'd that go? Oh, there it is. Jeez, I was looking right past it. So I'm just going to give a generic case management service. And if you want to make sure the date of the case management service makes sense for the project start date or the date of determination, I'm going to make it 08/01/2018 to match the determination date, and just say it was a 30-minute meeting, and then hit save. So I essentially just created a path service to go along with the status determination. You can do a case note here as well if you want staff to do case notes. Not required on the screen. Now you're done, hit done. And so you'll see the service that you just created for this particular client. It should be this one here for the that 8/1 meeting. And then if you go back to look at your project enrollments, you'll see that your client will show as having that 8/15 start date. Now, this is the part I was surprised about, is that this is blank. So date of engagement and date of determination again. So date of engagement, we have to make equal to, 15/2018, otherwise it won't take it. Status determination date, we should be able to make 08/01/2018. And then enrolled in path, no. Reason, client was not eligible. I'm not sure why that's not populating based on the enrollment info. Like I said, that's worrying me a little bit because the data's got to go somewhere, and it is attached to the enrollment. So we'll have to find out from Caseworthy what's happening with that. I'll take a look at that after. Let's see. Okay, oops. All right. So you have your enrollment, you have your one-time field, and you've got your client who is not enrolled. And now you have a choice. You can leave the client's enrollment open for the allowable time frame if you all say that it can stay open for 90 days and then close it. Or you can just simply exit the client now because you know they're not going to be eligible and you don't foresee communicating with them again. You can just click here and then do the full exit, or in this case, you could click here to do the exit because you guys don't have reservations. You don't have bed lists for that particular project. So you can complete exit assessment at that point. All right. But that's entirely up to you. Any questions about that?
Yeah.
Okay. What I'd like to do is now I want to really squeeze the report here and see if we can make some sense out of some of the stuff. 81018. Let's see, let's go to 16. Shorten the window a little bit. You know what? Let me do this. Go from here. So we should see our new person, number with active enrolled path status at any point. So actually we would think that we wouldn't see them there because they were not enrolled, right? Because in order to be on this line, they have to be active enrolled and date of status determination during the report period, and client became enrolled in path should equal yes. So let's see what happens. I got two of these open. I gotta close one. 8.1 to 8.16. Let's see if our test client landed on this report. And if they did, I think we can all agree that something's wrong. Good, so they didn't. So that's what we would expect. Our test client was identified as became enrolled in path equaled no. So we wouldn't expect to see them here. Now the question is, would we expect to see them anywhere else? So this would be number of persons contacted by path funded staff this reporting period. It's an active client, became enrolled in path as no, status determination is during report period. So for this report, did I close it? I might have closed it. Let me rerun that. You would think that person would be there because based on that rule, so the client became enrolled in path was no, and date of status determination is during the report period. Our report period started 8/1, right? And that's what we made for the determination date. So there must be a reason why. Now they call this person's contacted. So what we need to do now is let's go back and before we do that, if we click here, this will give us all clients. So let's look here and see how the system is seeing our path client. Because there's a series of tables here, or a series of headings here. And let's bring our test client. So here's our test guy. Calling homeless, no. Date of determination, 8/1, so that's within the report date. Contacted, that's probably our problem because the title of the field is persons contacted. So let's go create a contact and see if that solves the problem. And contacts are here, contact and service. We'll add a new one. Make it 08012018. Put in Where's your path? Is there. Service type, non-residential. We'll just say no, and then save it. Then I'm going to refresh the report to see if that makes any difference. And this is, unfortunately, the kind of stuff you have to do to test the effectiveness of a report. And so it didn't update it there. So there's definitely, in my mind, that there's something that is not working properly for this report. And it might be that the contacts aren't being read properly. Let's see if it, see if they got the contact on there. And again, another reason why you would really not want to dive too deeply. Yeah, see, contact is still no. So there's something up with that field. Enrolled in path, no. So it's reading that correctly. New is yes. So it's reading those two properly. It's active, so the enrollment's open. Data determination, and at least that's one positive. It's reading data properly. It just doesn't seem to be following the rules of the report the way it's been described to us. So this is a client, active, became enrolled in path is no, date of status determinations during report period. Expectation would be they would be here. All right. So it's really only going to impact your clients whose determination is no. It should be okay for clients whose determination is yes. All right. Is there anything that people want to look at on the path report, or is there a specific client record? Like I said, we can always stop the recording and dive into some actual records that you're having problems with. Entirely up to you all.
Do you know if the mapping for services has been fixed yet?
No, and you're referring to, if I recall, like if it called something, like there's two columns with services.
Yeah.
Yeah. No, that hasn't been fixed yet.
Okay.
No, and I assume that's Sarah?
Yes.
Yeah. I have all I have left to do with your path projects now is the people who had both a pre-screen and a regular path enrollment. I just have to make sure all the pre-screen services have moved. And then once all those pre-screen services have been moved and assigned to the correct enrollment ID, then I'm going to get rid of those pre-screen enrollments so you won't see them anymore.
Okay.
All right. And does anybody else out there have a pre-screen program for their path project? Or a pre-enrollment? It looks like Kim Wilson Housing does, but I don't think anybody from Kim Wilson is there, right?
No.
No. All right, let's look and see how many pre-enrollment programs there are. You don't need a pre-enrollment because of the one-time field implementation. It takes the place of that whole logic. Let me see if I can get that to. Well, it looks like just the two of you have that or had that. Yeah. All right. So it's just those two that had it. I'll work with them separately and talk to them about fixing that. Make a note. So I don't know if there's anything else that will be helpful for all of you. Most of you are pretty proficient at the enrollment process. Your biggest, I know for PATH, the biggest headache has been the PATH reports, contact services, and sort of, you know, the the date of engagement and all that stuff. So is there data, maybe like one of the topics we already discussed where, you want to change something like an enrollment or anything like that where you've run into a problem similar to what we talked about earlier about changing a date, or is everybody pretty comfortable with, how to fix or edit something like that? All right. Okay. Does everybody know what to do with an assessment? Oh, go ahead.
When you have someone already entered, can you change the birthday?
Yes. So you enrolled somebody and you accidentally put the wrong birth date?
I don't know if it was me or someone else,
Okay.
but the birth date is wrong.
Yeah. So case management, client demographics, and then you can just change the birth date to whatever you want. And I will enter one of the, let's see, 1972, one of the more noteworthy days in history, October 3rd, 1972. And I'm sure you can all guess what date that was.
Was it your birthday?
That absolutely was my birthday, or still is my birthday. So now that you all know that, I expect something on my birthday. It's coming up. Ironically, my dog that I have, he was born on October 6th, not 1972 though. Yes, it would. Yeah. So yeah, that's all you have to do to fix a birth date. And if you hover over the heart icon, it tells you the birth date, so you can see that it updated. Yeah, just about everything can be edited in Caseworthy if you have an assessment that you need to change. The key is that if you're going to change the entry assessment date on a particular assessment, you have to change the entry assessment date on all of them for that particular enrollment. Don't just do one. Like, don't just do the HUD universal start date. You have to do all of them because all of them are linked together. Yeah, but you can do that just clicking on the one you want. You click the gear, you hit edit, and you can make whatever change up here. If you want to edit like this date, you just click that or click the pencil next to the one you want to do, change it, save it, and you're done. All right. Again, we do have time, so it doesn't have to be a path question. If you have another project that people want to discuss, I could just stop the recording here and we could talk about other issues, HMIS related, that you may be having, or questions that you may be having about other project types.
Okay, Sarah again.
Yep.
I ran our APR for past